Hi, and welcome to RTP Business Live. I'm Bob Collier, your host, and today we have Dr. Kevin Prue. Dr. Kevin Prue is the owner and founder of Prue Physical Therapy and Sports Performance. Kevin, it's great to have you on the show. Welcome.
Thanks. Looking forward to it.
Absolutely. Let's get right to it. Why did you start your practice?
So I started my practice mainly because I was looking for a place where I could treat patients the way that I felt was best for my kind of style and to kind of get the outcomes that I was looking for. I was a big athlete growing up, and I wanted to have something where we could tie in sports performance into the rehab process as well, and I just didn't feel like that was really out there. And then the other big factor was I wanted to spend a lot of time with my patients, 60, 90 minutes per visit. And
that's unheard of, isn't it?
It is, and that's kind of why my practice is a little unique, and I'm really happy to do that opposed to other places where you're seeing new people every 15 minutes, and it feels like every time you see them, it's the first time you're seeing them because everything's so new to them, and the amount of time you're getting just isn't there. And so that was a big reason that I wanted to start my own practice and kind of get into the community and do some of those things.
We've touched on this already, but let's go a little more in depth. What makes your practice different from other physical therapy practices?
Yeah, so like we were kind of saying, I get to see my patients for about 60, 90 minutes per visit. So that means I can see them once a week or once every other week or sometimes even once a month only, whereas most people kind of think of physical therapy as this 3 times a week for 4 weeks and this generic kind of plan of care. And so getting that amount of time with my patients, first off, is a huge win for everybody. And then secondly, we get to spend a lot of hands-on time, which means when someone comes in and sees me, they're always with me. They're always doing something under my supervision or with my hands, and so that way they're never just kind of like put in a room and given this exercise sheet to work on.
Here, do this.
Yeah, here, do this, exactly. Throw some of the modalities like ice and heat and some of those things that I don't really necessarily call skilled care. Those are things that people can do at home, and so we can kind of walk our patients through how to do some of these things at home. And so that way when they're with me, they're really maximizing their time with the professional that they're paying to go see.
Absolutely.
And I think it's really important, especially now with the way healthcare's kind of changed and budgets and all those kinds of things, that if you're going to be paying for a service, you should be with the professional that you're paying to see.
For sure.
And so I just think that that's the best model that we have, and right now my patients are loving it, and so I guess that uniqueness has been pretty good for me.
That sounds like it. Well, let's talk a little bit about the services in a little more detail that you offer.
Sure. So yes, we are a physical therapy practice primarily. So I focus on sports and orthopedics. A lot of my patients are young, recreational, high school athletes. We have a few college guys and a few professionals kind of kicking around. But aside from the physical therapy, that hands-on kind of skilled care, we also offer personal training. So even if you're not hurt, you can kind of come in and start working on your health and wellness that way.
Okay.
We have sports performance training. So some of our athletes that may have come in with an injury and now want to take it to that next level of working on speed and agility and power development, we have that as well. We do a lot with injury prevention. Again, kind of being the athlete growing up, I was hurt a lot. I had a couple arm surgeries from being a pitcher in college. So the injury prevention part is really big for my practice. And then we also offer some pretty unique services, and we do video analysis for some of our performance enhancement and sports-specific mechanics. And then we also offer these mobility screens, which I kind of use as like a pre-sports physical or injury prevention screen. So I'm pretty excited about those.
Well, I'm not going to let you go without getting a little more in depth on video, because that's where I live. So why don't you tell me a little bit more about this video analysis that you help in your treatment plan? Sure.
So things like running mechanics, throwing mechanics, golf swing, some of those things that occur at really high velocities, it's hard for just the naked eye to see them. And so what we have done is we have video software that we can hook our patients up to, kind of looking at the mechanics of the running or the golf swing or the throwing, kind of look at what the angles are, what the forces are being developed, and that way if there's something not quite right, we can pick it up with that video software. So we can put together the right program instead of saying, well, it looks like your hips are a little weak or we need some more motor control here and there. We have this hard evidence now. We know what the angle is, and so that way we can work on something as far as, like, say, getting hip extension in your running mechanics, getting that leg back and then kind of driving it forward. And then we can track improvements. And so we know if we're on the right track or not.
Right. Excellent.
Yeah.
And the other thing that you touched on that I want to find out more about is this, what is mobility screen?
Yeah, so that's a newer program that we've offered, and it's kind of getting into the mainstream circles, but essentially Think of a mobility screen kind of like going for your annual blood pressure checkup or going to get your teeth worked on by a dentist every year. I mean, your joints, your muscles, all that stuff is very important to kind of have longevity of health.
Sure.
And so what we can do is in a 15, 20-minute process, look at all the major joints and muscle groups and get an idea of how well you're moving, what your strength's like, and if there's any problems that need to be addressed before something becomes more serious down the road. So like, for instance, back pain, a lot of people that have back pain, that problem can be caught before it gets too bad and you're missing time off from work or school or whatever it is. And so with these screens, we're given cut points to kind of determine, all right, looking at side-to-side differences, looking at what you look like last year versus this year. And so right now we're offering these kind of free screens to people, trying to get it more into the community.
Oh, that's wonderful.
Yeah, and so we're trying to get it, especially from our high school athletes, so we can look at what they look like during this fall season, during the spring season, and making sure that they're progressing the way they should be and stopping injuries before they happen.
Right, right. That's great, because I think people may know that their back's hurting, but they may not know why, what to go fix, where the weakness is, as you mentioned, that really is the cause of that pain, continuing or recurrent pain. If they could just strengthen those areas that are the weakness, then that back pain might not occur, or it'll be much milder and easily
Exactly. You're always
fixed.
trying to treat that underlying problem and figuring out where that problem's coming from and addressing that issue is always going to be the primary goal of our clinic. And we can treat the pain, we can treat the weakness, but if there's something else going on that you missed, that problem's going to come back again. And so we got to stop that.
Excellent, excellent. How do you get most of your new patients?
So we don't do a lot of actual, kind of typical marketing. Most people think of physical therapy as you go see your primary care physician or an orthopedist, and they kind of give you that referral to a physical therapist. Our practice kind of works backwards, where we act as like a primary care type of clinic, where most of my patients come directly off the street to see me. Because we're in the state of North Carolina, we have direct access to physical therapy, meaning you don't need any referral.
Okay.
So instead of going that route of going to see your primary care physician for back pain, where they will send you to an orthopedist, and probably the orthopedist is going to send you to PT anyway,
Right.
just kind of cutting out the middleman, and we'll take a look at you, and if we can't help you, we'll make sure we get you to the right physician to take care of your problem. But this way we're saving some time, we're saving some money, and the way this model's worked really well for us is word of mouth has been huge. Our
Wonderful.
patients have been very happy with what we're doing,
Right.
and so they're telling their friends and family, which is a great honor. I mean, when someone's going to give their family member your recommendation, that's a huge.
There's no higher honor than that. Yeah.
Absolutely.
So you've really flipped the model. People
Absolutely.
are coming directly to you guys for help.
Yeah.
That's wonderful.
Yeah, it's becoming more of a trend as people are starting to become more aware that they have this access to physical therapists whenever they want, and they can have that patient choice. It doesn't mean that we can help everything and that we're the right person to see for every problem, which is why I always recommend, if you're having some sort of joint pain, muscle pain, something like that, give us a call at least, and maybe we can talk over the phone and kind of troubleshoot your problem that way. And if I think you're a good candidate for someone like me, I'll definitely have you come in and take a look at you. And if it's something that may be out of my scope of practice, or I think you'd be better off served seeing someone else, we'll definitely kind of point you in that direction. So we're starting to build this big network of physicians, physical therapists, patients, and making sure that everyone's getting the care that they deserve and they need.
Perfect.
Yeah.
Perfect. Well, Kevin, we've covered a lot of ground today. I want to make sure, though, that we've touched upon all the things that you want people to know about your practice. Are there any areas that we need to go into a little bit more?
I think the biggest thing I want to reiterate is if you need some physical therapy or you're having some pain, go see a physical therapist first. I mean, that's our area of expertise is musculoskeletal, joint, muscle pain, that sort of thing. And by doing something like that, you can save yourself a lot of time and aggravation trying to go through the healthcare system and finding the right provider. But thanks for having me. It was a great show. I really appreciate it. And
we're honored to have you. We appreciate you taking the time out of your day to come talk with us.
Thanks.
Because I think people have learned a lot today.
I hope so.
And if folks want to learn more about Dr. Kevin Prue and the Prue Physical Therapy and Sports Performance Practice, we'll have information at the end of this video, and we'll also have information on the webpage so that you can get in contact and find out more about their services. Thanks for joining us today. Again, our guest was Dr. Kevin Prue, Prue Physical Therapy and Sports Performance. Come check us out again real soon.